by the way.
So
I think only
I think the
USMLE.
host can do that. If you click the three dots, there
Um,
you will see the option just beneath the whiteboard of recording.
And I think recording is a good idea. Later we can hear our sound, our annotations, how we talk, that will help us.
yeah, we can do that. You please go ahead. I'll just see if I can record it or not. I'll just see. Just go ahead. Somebody else wants to answer this question. Yeah. So Vijay is telling that we need to take a consent. Is everybody fine that we can record the session? Okay. Anyways, I'm recording. Doesn't matter.
Even
So yeah, if please anybody wants to just go ahead with the answer, you can answer. Even you can, you don't need to turn on your this camera. You can even speak. Like just turn on your mics and speak. Right? It's a good chance to you're getting a chance to speak and
Hmm. And Nikhil, your hand is raised. You want to say something?
yeah, Nikhil, please go ahead.
No? Okay. So I want to add a little something to this answer. So the thing is, personally, and from what I have heard from my friends who were in the interview last year, they said that it's better not to give a sure shot definitive answer like I see myself practicing as a cardiologist or a nephrologist or anything like that, because you never know what might happen and you never know the future may change, so we should keep our options open. So what I personally have decided to how I would be approaching this answer is that I have a background of working in pulmonary and critical care for a year or so. So I would be telling them that right now I can only answer based on my experiences that I have had so far, and they can change as I get exposure to different specialities. But if you ask me right now, based on my own experiences, I would say that 10 years from now, I might be seeing myself as a practicing pulmonary and critical care physician. But in my residency, I will be getting exposure to other fields such as cardiology, nephrology, hematology, and oncology, and I will be just taking them on with an open mind, and you never know, my path may change as well. But one thing that I can be sure about is that whatever capacity I might be practicing in, I would be trying my best to be a compassionate and successful physician who is doing his best to help and cater his patients. And does anybody have a comment on that?
yeah, it was good actually.
Yes, what you told is okay. I think it's good.
Thank you. Anybody else wants to give an answer?
And I think you can mention something about your family too, apart from the medical background.
Yeah, you definitely can. But for
Oh,
me personally, family is not that big of a thing, so that is why I have not mentioned it in my answer.
Yeah.
But if family is a big thing for you, you can definitely mention it. I would actually say if you are interviewing in a small community program, it would actually help you because small community programs are usually looking for people who they can retain in their own community.
Yeah. So
Ashma, would you like to add anything to this question, like, or how would you answer to this question?
So like I have prepared for this. Like I just so that's a good, very good question. So in next 10 years, I see myself as running successfully running a private clinic myself and working there with my team to serve the community. Secondly, I want to have a family, my wife and my kids, and I want to live in a suburban area. Thirdly, I see myself exploring new places, food, and experiencing new things in life. And lastly, I run an Instagram page with 1,700 followers so far, but I want to reach out to more people in the future and turn into a social media influencer and even run a YouTube channel where I can just make vlogs every day. Yeah, so that's how I see myself in 10 years. Having said that, your plans definitely they change as I experience new things in the next 10 years. So my plans might change accordingly. Yeah. So that's it. Yeah, Harshita, you want to say something? Please go ahead.
So Ayushman, I have a doubt. You said that you would want to live in the suburban uh, like setting, right? So would like if we give an answer like that, would it clash with let's say like the program being in an urban setting or something like that? Would that make any issue? Like I mean, would that pose an issue?
That I can only say after I go, like after I get some feedback or something. But yeah, I think like some answers should be like that's what I feel like. I see myself in 10 years, right? But like living in a suburban area, like serving the population. At the end of the day, I'm working and serving the population. It shouldn't matter that I'm doing it in New York or I'm doing it somewhere in Illinois, right, or somewhere in Maryland. At least I'm serving the population of United States, and that's what I was trained for.
I think you can do one thing, Ayushman. Instead of telling about suburban community, you can tell something like peaceful or
Yeah,
subtle or anything
yeah,
like that. Peaceful community.
yeah, I can change my answer. It's just like that's what I thought, but when I start framing, I'll definitely change it. And I think, yeah, I wouldn't be mentioning a suburban area or something like that for sure. Yeah,
So we
And
can
it's just
generalize
a draft. It's
city
just a
first.
draft right now, right? You can always frame it differently according to every program.
yeah. So anybody else wants to speak on this question? Yeah, Rutwa, like you want to speak, just go ahead, please.
Yes, hello everyone. I haven't prepared my answer yet, but from what I know, when you express your answer, just be open that you are open to everything. You are here to learn. Like from I suggest that don't directly go on a conclusion that I want to be a cardio fellow, etc. So like show them that you are open to everything and you are open to change and adaptability. So that will be a plus point.
Yeah, sounds legit. But yeah,
Can I answer this question?
sure, please go ahead, Dr. Yusuf.
Yes. Thank you for asking me this question. Actually, I practiced as a primary care physician before, so I want to pursue a career in the primary care track after finishing the residency. Um, I might change my goal when I get into the residency. I'm open to other options, so this decision I can't claim to be final. Apart from the medicine, I want to like travel to more countries with my family, as I like traveling, one of my hobbies. Your comment?
But when somebody like as Rutwa said, like, but Rutwa, when somebody asks you like, what do you see in yourself in 10 years? At that time, like, if somebody asks me about like a question in next 3 years or like about residency, I can tell them that I'm open to new things. But when I see myself down the 10 years, I do like I would have to mention that how I see myself, right? Like we don't know if we are a program, like depending on the program, we can't mention about the fellowship, but yeah, either we see as a hospitalist, we see as a primary care doctor. Apart from that, like we want to travel, we want to explore new places, meet new people, or somebody wants to get married, somebody wants to have children, somebody wants to bring their parents to America and have a big family in America. So everybody will have different goals. But yeah, when somebody asks you like, how do you see yourself in 10 years, right? So like at that time, like we should have a specific answer or something. Like that's what I feel. I don't know. I and that's my first math season. So it's my first experience, but yeah, that's what I have heard watching the webinars and everything. That like you should at least mention when they ask, when you can just add a line, the like that experiences make you better, and they make you mature, and your choices can change with time, definitely.
Yes, basically, we have to like give them a sort of definite answer that if things go according to plan, these are my goals. But I'm open to new changes, and I don't know what's going to happen in my life in 10 years. So my plans may change, but if everything goes according to plan, this is the plan that I want to achieve.
Right. Do we have Vijay with us? Vijay, you want to speak something?
I don't see him right now.
I think yeah, he left or something. Maybe. Anybody else wants to answer this question? We still have 6 more minutes. Like we can then after that we can shift to a new question. Like it's yeah, Siddharth, please go ahead. And Rutwa, yeah, after that you can just speak.
Yeah, so 10 years down the line, I see myself taking care of my patients and be involved in academics where I teach future physicians. The other part of my professional goal would be raising awareness regarding HIV prevention in the community. And I want to get training from NIH so that I can take my OSF research initiative to a new heights. Personally speaking, I see myself traveling the world with my wife and two kids. So that's how I see myself 10 years down the line.
That's a good answer. Like yeah, that's how you have yeah. But yeah, if it's good, like at the end you add, like Unaib said, that if everything goes by, that's how I see myself. Otherwise, I might gain new experiences with the coming time, and my future goals might, and that might affect the future goals. You can just phrase it like that. Otherwise, it's a good answer.
Yeah, sure.
Yeah, Rutra, please go ahead. You wanted to speak something.
Um, Actually, I accidentally pressed on the hand raise button, but the like I want to ask that can we categorize our answer? Like, okay, for my professional, in my profession, I see myself down the line in 10 years this way. In my family perspective, or like, can we just categorize it and say,
I
like,
think you
everyone
can.
suggests
Like,
that,
or yes,
yeah.
I think you can.
Yeah, you can just say like professionally, I must see myself this way, and in my personally, I just see my yeah.
Mhm.
That's a good way to answer a question. That's a good thing. Like we can
Yeah,
even
because everyone suggests that you frame your answer in multiple of three, right?
yeah,
Strength,
yeah.
like top three strengths, weakness three. So like we can, and always the answer depends on what years they are asking. Like how, where do you see yourself in 5 years, 10 years, 3 years after residency? So answers might change.
Yeah, yeah, of course. That's a good thing to frame our answers. Yeah. Anybody else wants to speak on this?
Just to add, I think like instead of just saying, professionally and personally, I think when you're saying personally, you could also say, like other terms to use would be beyond medicine or outside of my career.
Okay. Yeah, that's a good thing. Beyond or outside my career. Yeah, we can just note that point. Yeah, that's a good thing. Yeah, it'll skip my mind. So I today was thinking that somebody asked me about the healthcare system of my country, like India especially. So we can even mention about Ayushman Bharat scheme, or even like if you want to praise our healthcare, we can talk about Ayushman Bharat scheme and even the Sanjeevni, that is a telehealth initiative by the government of India. So you can even add 2 points to that as well. So anybody else wants to speak on this question?
Nobody wants to speak. Can we move on to the next question?
Yeah. So like, what should be the next question? Like, there are many questions like that I got to know today, that what you can contribute to the U.S. healthcare system, or how do you see the medicine will progress in coming years? Like, I just saw these questions. They were like very catchy questions. Because so you can just tell what can be the next question. We can move over that, because I don't think we will be discussing here what's your favorite, like how do you relate to the particular animal, car, or color. Like, we can just keep it for the end. It's not a very important question.
What
Yeah,
about failure?
And
uh,
also one more
Can you
question
tell
like,
me?
also, Ayushman, you said,
Mhm.
how do you contribute to US? So that's the question. How are we going to contribute to you? Like they can ask you, how will you contribute to this country where you are getting this education?
Yeah. So I don't have any answer to that question. So what I was thinking was, I'll just put a response post again on my Insta page with the same question, and then I'll get the response, and I might get some idea, because those who are not preparing for the interview will have very good ideas, right?
then Aishman,
Yeah.
you can do one more thing, right? You can also add this question. I have seen this question like, what are the challenges we are going to face in this internal medicine field in the
Yeah,
future?
yeah, exactly. That is again a question. Like, these are the few questions that are difficult to answer, because other questions we can answer properly with,
Yeah.
practice. But these questions, like how will we contribute to US healthcare? Does if somebody wants to speak about that, please go ahead.
Yeah, say something, few words at least, so then.
If somebody can answer that question, or we can just discuss why should we take you to our program, or like why you amongst 200 applicants should be ranked first. Like,
Aishman, I think I can give a draft to that question like, how do you contribute to US?
sure, sure,
Like
let's
Mhm.
we have
go
seen
ahead.
in this next 10 years question, right? So we are going to do as a primary care physician or doing some voluntary healthcare. And somebody else told us like regarding raising awareness to the people, or we can add these things like, oh, I want to raise awareness among the backward communities or underprivileged people, or doing some voluntary programs, and I want to become a primary care physician and help same underprivileged people. Or we can somebody told about research also. I want to do research on this, that we can do that. We can also add that. Is there anything anybody want to add? At present, I thought of these.
Yeah, that's a good point. We can serve to the like we can help the underserved people. Even in US, there are some pockets of poor people, after like socioeconomic issues with like some African American uh, society. Like there's small pockets, not very big though, but they are underserved.
I wouldn't say there are small pockets. There are huge communities with lack of health, proper health care. And as far as contributing to the US healthcare system is concerned, even if you have just opened a clinic in a posh neighborhood, you are still technically contributing to the US healthcare, even if you are taking care of the rich. So it's kind of a given. If you are working there, you are contributing to the US healthcare system, even if it's as a hospitalist or as a clinician, as a fellow, as an attending, even as a resident, you are contributing to the US healthcare system. It's not like I am contributing to Pakistan by doing my residency in the US in any way. So it's already kind of a given. So I don't think they are going to be very much excited about this particular question, because if they are taking you in, they are taking you in because they are a business. They are not giving out charity. If they
Yeah.
see you contributing to their program and to the US healthcare system, then they're going to take you in.
Agree. but they want to hear from you, how you think, how you express the things.
So Sheetal just raised her hand. Sheetal, you want to add something to this? Yeah, please go ahead.
Uh, Hello, everyone. I'm Sheetal, and I think this particular question, I think they would, especially being in IMG, I think they would want us to give a perspective as to how we would contribute being different from the US. So I think I personally, I've been in India, in the state of Qatar, and now in the US. So I would like to answer the question in a way saying that I would try to use my experiences in the aforementioned countries that I have amalgamated through the years to make an effective impact and differences in the current practices in the US, incorporating the experiences that I have had in all of these countries to make any possible difference or change in the healthcare system of the US.
That's a good. That's a good way to answer. Yeah,
Can you repeat it, Shwetal, once again?
yeah, please.
Yeah, I think, I mean, this would probably change with every person depending on their background. But I think for me, since I've been born and brought up in Qatar and also spent a good amount of time in India doing my undergraduation and also been exposed to the healthcare system in the US right now, I would try to convey that I would use my experiences in the aforementioned countries to amalgamate the experiences into deriving practices that could make a difference in the healthcare system of the US. Since I have had an experience to the different practices followed in different countries, which would indirectly enable me to pick out the best practices from each country to make a difference in the healthcare system of the US.
Okay.
That's a good answer.
I have a basic question, guys. Can I ask you? See, like in India, we don't use this word hospitalist very often. So, in terms of US, like hospitalist means what? Like somebody who done with this thing, IM, and then they work into hospital. That's what you mean?
Yes.
So, a hospitalist is basically
Mm.
a medical practitioner who is working in the hospital medicine department,
Mm.
and you don't need to do any fellowship or anything like that. After an internal medicine residency, you are eligible to practice as a medical practitioner in a hospital medicine department, which is overlooking a bunch of kind of all the specialities, and it is a big thing, especially in community programs where there are not big departments or huge departments of cardiology, gastro, or anything like that. So in such community programs, there is a hospitalist who is the primary physician, and then there are subspecialists like cardiologists or nephrologists or gastroenterologists who just work as a visiting or a consulting physician.
Mhm.
That's
So
basically.
if we do from IM internal medicine, we are hospitalists only for IM department, right? Internal medicine department.
A
I think we also
hospitalist is.
have it for family medicine too. I don't know about family medicine, but I think we have something for family medicine too.
Yeah, after from what I know, you need to do a 1 year of hospital medicine fellowship or something like that after family medicine in order to practice as a hospitalist if you have a family medicine residency.
Okay, right now I was talking about after I am doing IM, like we can.
After
Yeah.
IM, you can just work as a hospitalist directly.
Okay.
Even after family practice, you can work at the hospital. It's relatively difficult, but you can work. At the end of the USA has shortage of doctors. That's what Dr. Maya, mentioned in one of the dance movies. Yeah, so we have two people who raised their hands. Artsum, you can just speak. Yeah, Artsum and Sheetal again. Yeah, both of you can just speak.
Oh, hello.
Yeah,
Hello, guys.
hello.
First, thank you for the meeting. This is really interesting one. So I wanted to just respond about what can we contribute to the USA, and I like the answer that we have like different backgrounds and different experiences, but it can be actually risky because one question that comes to my mind is a follow-up question about, okay, tell me, like it was kind of general. So tell me, what exactly do you mean? So I think I'm not from India, I'm from Georgia, but you can it's just my idea, that you can also say that you have seen a lot of infection. You're like kind of really experienced in infectious diseases, and you can say like we have the background of these having different scenarios, and uh, I can contribute my experience from this side. But what I was thinking about it, we can frame this question along with the question, what is unique about you, right? So, what is unique about you is also linked to the question, how can we contribute to the US system? So, I was thinking we can also talk about, just brainstorm the ideas, what is unique about us that then links to the question, oh, how can we contribute? So one of the examples that just came to my mind, not to like be general, because all of the applicants in the day will seem like general, and we can overlap a lot to each other. So I think we should just make another ideas. What can we answer this question like? Not a very general. That's it. Yeah, I hope I made my point because sometimes, like, how we think Georgian, we just translate into English directly, and it changes the idea sometimes. I'm done.
So yeah, even like I just want to add one point. Like I can even speak about like I come from a country with wide ranges of pathologies and diseases. I can bring that knowledge and help in the. I can bring that knowledge to the U.S. healthcare system. Like that even can be a point.
Yeah, I was meaning that one. Yeah, that's the one point that just came to my mind. But what else can we do? Like, I don't know. That what is unique about IMGs?
Yeah. Like if they don't ask me like about my this what do you say, strengths or something, like I can even talk that being more working in a kind of working in a setting with a meager resources that made me more efficient. I have to treat a lot of patients in a limited period of time, so that made me more efficient as a healthcare worker, so I can bring that efficiency to United States as well.
Yeah, that is a very good point that the workload and the pressure on the doctors in our home country is a lot. So that efficiency can be brought back to United States.
Yeah. Anything else anybody wants to add? You can even raise your hands, or you can directly switch on your mics and speak. That's fine. Sheetal, you just raised your hands. Do you want to speak something? You just raised your hands earlier.
I'm sorry, that was by mistake. Thank you.
Oh, that's fine.
And I think Ayushman, in the meanwhile, can we think about this question like what are the challenges we are going to face in IM in the future? Also, along with this, contribute to US question.
For
Anybody
that, I
else
think,
want to?
yeah. For
Anybody else
that
want
question,
to
I
add
will
this?
go read more publications first. Like I have to read some. You have to read some text on that, right? Like, or you have just points. You can just speak it out right now. Like first we'll talk about like how we can contribute to U.S. health. If somebody wants to add something extra,
Yeah.
apart from like efficiency, or like she told that she has a like somebody told that they have multiple experiences from working in a different head settings, they can bring that to US, right? Apart from that, anybody wants to add something else? Yeah,
If
Siddharth, please go
somebody
ahead.
has, sorry,
Yeah, Siddharth, please
Yeah.
go ahead.
Yeah, so United States is already excelling in the term of medicines, but I believe that there is a lot of growth opportunities in terms of healthy nutrition and lifestyle modification. So, being an Indian, I would bring my understanding of yoga and healthy nutrition to your program and United States in general.
Yeah, that's even a good point. Something unique. Definitely, India has yoga to offer to the world. Or
Right, like raising awareness about these to the people.
Yeah,
That's a good
exactly.
point. That's a good
And
point.
also to bring something that will like bring the expenses of United healthcare down.
I think that's not in our hands.
No, like if we prevent things, obviously the expense will go
Yeah.
down. Prevention is better than cure.
Yeah, we can just add
That's
that point
right.
that in future we can just participate in policy making and make healthcare more accessible in US at lower costs. That can even we can do, right? As we gain more experience working in US and understanding it in a better way, we can just take part in the policy making as well, and we can just make healthcare accessible to more and more people in US at a relatively lower cost. Like this is a challenge in United States. Healthcare is a challenge over there.
Yeah.
Yeah. Indu, you please go ahead. Just
Also,
speak.
it's also if somebody has colleagues, and I would hope to like improve those skills further and like take up a teaching role or as an educator too.
Mentorship.
Yeah, Sheetal, please go ahead.
I think another one option could probably be US, since it is a country giving a very high weightage to research itself. If we are someone with some experience in research and we want to pursue something in the field, I feel it would be a good idea to bring up the topic and say that I would probably say that US being into the field of research and having opportunities to provide even funding for great research, I would say that I would want to work in the field of developing personalized medicine for my patients, because I think we are moving towards the era of uh, treating diseases more in a personalized way, because a huge number of diseases these days, though we have improvements in further research, and probably we should focus on that, especially if we want to highlight our involvement in research.
Yeah.
Thank you.
$0.99 in India, and it's very easily accessible to all at a very cheaper rate. I can bring that technology to to United States, and definitely it will help the people out there because it's a diabetic. It's one of the diabetic capitals of the world.
I think US already has that technology. They are making insulin at 10 cents a piece.
It's
They are
pretty
just not
expensive.
selling it at that price. Thank you, insurance.
Yeah, I think all technologies here, they are not ignorant about anything. The only thing is this country is expensive.
Yeah.
It's just the insurance and the big pharma
Yeah.
and the insulin patent that is causing it to be so expensive here. It's not the technology.
Are you audible? Like you can even speak. We can hear. We can get a chance to hear you. Like if you want to speak, that's fine. Otherwise, yeah. Anything? Anybody else wants to add something to it? Please go ahead. Or
Can we summarize until now what we have told to contribute to yours?
healthcare system. Yeah.
Or anybody else want to add anything?
High health is invaluable. What's your name, friend? Yeah.
Yeah, that would be more easy to, address the person if I know the name.
Yeah. So like let's summarize first and then we can add more points. We still have 13 minutes to go. Then after that we can discuss other things as well.
You want to summarize, Ayushman?
I think somebody else should do that. Like everybody should have equal chance. I can speak. I just
Yeah.
keep on speaking.
Can
So
anybody summarize until now, or can anybody add their thoughts to this?
or you can even add something to it. Please go ahead. Adik. So yeah, you can summarize in case you want.
Okay, so things like I'll be telling in a very short forms like voluntary programs, raising awareness about yoga and healthy nutrition or any diseases, or primary care physician or as a hospitalist in a hospital, about research. Somebody told about the developing personalized medicines for my patients, and educator or a mentorship. And I would like to bring my experiences from my home country to here, or working efficiently and having a too much like work life workload from India or some from my home country to here. Anything else? And bringing healthcare access to as many people as possible,
Yeah.
or as you have told, like technology from my home country to here. Anything else? Anybody else want to add anything?
Yeah, I wanted to ask something regarding this point about yoga and stuff. So, like in India, we have a lot of forms of alternate medicine, yoga, Ayurveda, Unani, and everything. But even in India, a lot of doctors look down upon these things as they don't help, or they make the patient worse, or delay seeking of healthcare in seriously ill patients and stuff. So until we know what if the program director or anybody on the board does not believe in stuff like this, and they think it's regressive to think about these things, won't they take to it negatively, like, oh, you support this kind of medicine?
Most of them actually do.
Yeah, actually, that's a good question. But I think we are not mentioning about other types of medicine like not allopathy, like homeo or Unani or anything else like Ayurveda. So I think don't
See,
mention it in that way. You can mention it as a broader way, like something like
Holistic care, maybe call it like
yeah,
with
Exactly. You
exercise
can
and
call it a preventive care because yoga definitely doesn't treat your disease, but it actually, prevents it, right? In many ways, like it can treat a lot of
Mhm.
things, right? So I
yeah,
don't think it's an alternate form of medicine, but yeah, that's how even the world celebrates the World Yoga Day, right? So I don't think like it's an alternate form of medicine, right? So after that, they might start discussing about the yoga as well. That's a good point to discuss, right?
Right,
But
right.
yeah, but US definitely has his own forms of medicines, like they have chiropractors and other stuff as well. They even believe in alternate medicines, but we are not mentioning about alternate medicine. It's a preventive care that would come under preventive care. Like that's what I feel. Yeah,
I
Okay.
can add few
sure.
to what we are talking about. Uh, See, guys, health is an over health is a big topic, right? And yoga is nothing different. Yoga is a kind of exercise. It's a sub type of exercise, but in a particular fashion, which like India has evolved with what yoga is. And also the best part about yoga is that it is recognized all over the world as Yoga Day 21st June. So it is like accepted by the people, and they easily accept that, irrespective of country, culture, and faith. So yeah, yoga can be inculcated into the medical practice, and that will bring a more well-being, more overall holistic picture of the health. Yeah.
Just see yoga as a form of exercise. That's it.
Yeah,
Yeah.
like breathing exercise and everything. It's not. Yeah, it's a kind of like it improves your breathing capacity or lungs. It helps to improve your lungs and everything. But it's not an alternate form of medicine. Yeah, that would be like if I talk about Ayurveda, Unani, or other like whatever practices we have, right? So like
No, we won't say these words,
yeah,
Ayurveda,
we just
Unani.
say
We
yoga.
just
Like
say yoga because breathing is helping stress, how to overcome stress. Like these are the techniques of relaxation.
yeah,
Yeah.
yeah,
many
exactly.
ways, many of the people in US have already started using some herbal products without contacting their PCPs. So we are not going to mention it, the controversial terms to the PDs anyways. So yeah.
Yeah. Anybody else wants to add something? Please go ahead.
We can
Vijay.
also add, hello.
Yeah, yeah. Please
You
go
go
We
ahead.
can
ahead.
also add the treatment that we have. Yeah, we can also add the treatment that we have we have used in India at the time of COVID-19. Those times, we people in India were having so many things as in home based care and so many things which we were using, and US was lacking in those things. And even in research they have mentioned this thing that people in India using those resources, and they are getting better soon, but not in US. So we can add
You
those
can
things
use a
also.
generalized term for that, like you can use my
Yeah,
knowledge
just
from my country, from my home country. I'll be using that knowledge here.
Yes.
just don't use the words US is lacking in those things.
Yeah.
That is going to be a problem.
We can
And as
add on that
far
we
as
can bring we have experienced that in India, and we would like to bring that thing in US also.
yeah, you can rephrase it. Just don't make it sound like that you are boasting about your home country or you are looking down upon the American system or anything like that. As this whole discussion goes, I actually did a rotation with an attending here in the US who was against, kind of against any form of Eastern medicine, and he was really headstrong about all everything Western medicine, and he was like these Chinese and Indian practices they don't work, they're just people, snake oil salesmen and stuff like that. So that is why I personally, that is why I said that just be careful while mentioning something like that, because you never know what kind of a person you are giving interview to. Maybe the person that you're giving interview to is a big fan of Eastern medicine. Maybe he is just another hater. I don't say that Eastern medicine doesn't work. It does work. I am from Pakistan. I have seen people get better by Eastern medicine. But would I be open to risk it in an interview for a residency? I personally won't.
Yeah. That's a point that we should
Yeah,
be talking about alternate medicines for sure.
we have to be smart enough to judge, how the person who's taking our interview, like what direction he's taking us. So best deal is to be neutral. Never like this Indian and Chinese and whatever Eastern, as you said, very good. Because they don't have proof, they don't have research, they don't have evidence-based things. That's why we should not don't post about those
And
things.
why is Eastern medicine?
But it's not a
That's what
medicine.
my
Yoga
point is.
is a
It's a
accepted
part of the
universally
Eastern
accepted.
healthcare system, Eastern medical system,
But
isn't it?
yoga is not a medicine. It's a part of a living.
So yoga is actually a way of life. It's not a medicine. It's like
Way of life.
modification that you can make. Like people
Yeah, that's a
exercise.
good word. Lifestyle
Like I
modification.
would say that's our way of
I think like overthinking about yoga, it's just here who is really experienced in yoga. So what I wanted to say about the contribution to add about something treatment from our countries, they do look for the evidence-based stuff. So I wouldn't risk it to say about it that I recommend some drugs that they do not realize that it's evidence-based or worldwide, and they would ban it. So they should have the secure feeling that we will not manipulate patients out of the system. And thirdly, I want to say about whenever we say good words about contribution, it is psychological way that PD may want us to like reverse our question and would say, "What do you think? Would you go back to your country?" Because I know this is another question. So if we say very very good things, there comes another question, right? So I was thinking how we should respond to it. Because personally, I think of coming back to my country about 20 years after, 25 years after I'm professional, I'm done, and I want to contribute more at some level to my country because professionals would be a lot in USA, but will be lacking in my Georgia, like my country. So what I wanted to say that it's another opportunity that another follow-up question can be, are you going back to your home country and how we should respond to it? I don't really want to reframe, make a different flow. The least we have questions, they are coming up. What's just a real follow-up question that it can be, you know, follow-up question of this question. Like, you okay, you contribute, you are really good, you want it, but are you going any farther back to your country? You have used the US system and you became professional you wanted to be. Thank you.
So, like, should we go ahead or somebody wants to add anything else?
Hey, Aishman, I have a question. If they will say, just like one of our speakers said, if they say, let's say, would you like to go back to your country after residency? So, how will we react to that?
So, like, I see, like, we had the similar question in the past meeting as well, right? So, at that time, I think we had Parul with us. So, like,
You can just tell the gist, like in brief.
yeah, so actually at that time, like, I attended personally, I attended one webinar, and she was attending. So she had done her fellowship and she was working in US. So she told that when somebody, they are going to pay you at the end of the day from the taxpayers' money. Like, but if you add something to it, like if you say I want to go back, then why would they spend that money when they have 199 other applicants to choose from, right? So even if you have something in your mind, yeah, you want to come back, but she told that attending told that it's not a good idea to mention because they are going to spend from their pockets, right? They're going to spend a lot of money on you. They're going to invest a lot of time and money, and just because you have to go back to your home country at the end of the day. But yeah, then I think it was Parul at that time during the meeting. Yeah, so that person,
No, 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 no. I don't mean that. Sorry, sorry. My question. Let me rephrase it. I meant to say some of the I heard like people these US guys are scared that hey these people will come in US as whatever the way they come and then they settle down here they get this that so some are afraid that we'll just you know a more brown population in their country than the white people. It's a Republicans and Democrats. That was one of the debate I was listening in when the politics was going on. So how if they say would you how like if they say would you like to go back to your country, then how would you say I won't, I will not, or what's the reasoning? Yeah, can you say again, Ayushman? Sorry, I
I
didn't
would, if
understand.
somebody asks me that question, I would never say that. I would say that I want to practice medicine in US, right? I would
Okay.
definitely say that I want to practice in US, right? Yeah, that's a separate thing. Somebody might be having some component of racism or something. We don't know. Like, we are
Hmm.
getting interviewed by that person. We don't know him or her personally, right? But at the end of the day, we have to understand that US have a shortage of doctors. Like, I was serving in Decatur, and they don't have doctors to treat their patients. They need doctors, irrespective of their background or something. They need doctors at the end of the day. But I would, to that
All
question,
right.
I see myself working in US. Yeah. So yeah, Hina, please go ahead. You just raised your hands. Please go ahead.
Yeah, so Ayushman, I was thinking that you mentioned it in quite a good manner that what you want to say about the shortage of doctors in US and how the program is gonna spend money on you and they want something in return that you should be working for the welfare of people of US. But my point is if you're on J1, that's necessary for you to return back to your country. For example, if I'm from Pakistan, for J1, I cannot stay in US forever. Like I have to go back to my country and then I need the waivers thing. I think it's for 3 years or something like that, and then you can move back to US. So
No,
for
you
me, it's
don't.
a tricky question.
You don't have to
Okay.
go back to your
You
home
can do a
country.
visa waiver job in the US for
Yes,
3 years
also.
in a resource limited setting and
And
then
Yeah,
most
but
get
most
moved.
of the
there's also
people,
option of there's also the one of the options, right? You can get a waiver. Either you can go back to Pakistan and then you can serve there for 2 or 3 years and then you go back to US. It's like that.
but no,
These are the
nobody
options.
actually goes. But nobody actually goes back to Pakistan to do their waiver.
No one does so,
Yeah.
but that is one of the options, right? Like everybody's fortunate because they are getting waiver, staying in the US, they are working in periphery, so they are just fortunate enough. But still, if you are on J1, there is a condition that you have to go back and serve in your country for like 2 years.
Yeah, but what I've heard from most people about that is once you go back to your home country, it is very hard to get back into the US medical system, especially to get like a
Yes.
fellowship or get a job because you have been away for
Yeah.
3 years. They consider it like a break in your continuity, basically.
Okay, so we should be telling them that we want to stay in US and we want to serve the people of US like that.
Absolutely. Ideally,
We
you
should
should.
have, okay, I understand your point. So it shouldn't be their concern that if I'm lucky enough to find a waiver or not. Makes sense. Thank you.
Yeah.
Say that last time that somebody this question was raised, like I'll just finish it like what it was discussed, that the other person said that she had a different perspective on this question, right? Like she even attended multiple webinars, and they said that, like her residents or her seniors, they collaborated with the healthcare in India, right? So you can even mention like it's you can even mention, like she told that it's a mixed view, that you should tell that you want to come to your home country or not. Like for me, I would never mention that, but yeah, then she gave another perspective that like you can just collaborate with the healthcare here, and you can just work for the welfare of people. You can say it even that way as well. So yeah.
Okay, thank you, Ayashman. I get your point. Thanks for explaining this.
Yeah. So
Yeah, and in a broad context, what is happening in the US is the birth rate is too low nowadays, and the elderly population is increasing. That means the population pyramid is shifting towards the right, and for fostering the need of that growing elderly population, they need a certain number of youth, and that number, like the current birth rate, and those who are reaching adulthood, this number is not matching with the people who can foster the health or overall the needs of the elderly population. So for this, they require immigrants, and like they have this strict policy that certain number of they allow only certain number of immigrants per year, and physicians are always on the top of this priority, because like so they would always want us to stay there and serve their population because of this thing.
Okay, yeah, makes sense.
So basically, I also think that we should answer it that way, that I'm gonna settle in the US, and because like there is severe shortage of doctors, and because immigration is the need for this country, then we will be collaborating in that.
yeah, we can.
They,
Just
a word of caution, guys. Somebody, I was somewhere in seminar. Do not use adjectives too much, like severe shortage. Instead of don't say severe, just say shortage. They just shortage or not. Don't say severe like extreme adjectives. All right.
Okay, okay. Thank you for the clarification.
yeah. So like we are done with the two questions for today. Like the UN, like firstly we talked about like how we see ourselves in the next 10 years, and the second question was the like we discussed right now is like how we can add to the US healthcare system, right? So like so somebody wants to add something to both of them, or like we can discuss something else as well, or even somebody wants to introduce yourself here. Just go ahead. Like even you can just go, because we discussed two questions for the day. We can move on to the other question. Yeah, we can move on to the other question, but we have to think about that question. Let me see. Somebody has an idea? Like, what should we go on? The next question is
What animal would you relate to?
that's a funny question though, but
Yeah,
weakness.
yeah. Let's answer that also. Funny one.
I would call myself as a panda, a polar bear, right?
Why?
I
Like
mean, you need to give a reasonable
like
explanation for
Siddharth
that.
just mentioned that let's talk about the weakness. So jokes apart, like we can talk about the weakness as well, Siddharth. let's do weakness, let's do important questions. So like we have
Yeah.
done with the weakness before, but yeah, if you want, we can just repeat that as well during right now because we're done with the two questions for the day. Siddharth, you want to, yeah, Karnveer, please go ahead.
Hello guys. Guys, I'm new to this group. I'm Karan Peer from India, as it's very clear. So I just want to ask that from how long the sessions has been going. Like I've been asking questions in the group every now and then about my late application. So like we are discussing on daily basis. How's it going?
So yeah, currently the main idea was to start somewhere with the interview preparation. I know it's not a perfect way to discuss things, right? There are other, formal and better ways to prepare for the interviews for sure. That you have to do your own research. But I was like, we have a group of people with us, which now, just recently yesterday, like we have 1,000 members in the group. So at least even if we do 1 hour a session or even more than that every day, at least we'll contribute something towards our preparation, right? Otherwise, like for me, like sitting for the whole day at home, I would never prepare for anything. I procrastinate and I do nothing, right? So that was
No.
like my way of preparing. So I thought like let's add other people also as well to the preparation. Plus, it worked for me because I wanted to be camera friendly. I just wanted my camera shyness to go away. I wanted to speak well. So this meeting gives me a chance to speak and communicate with everyone. Plus, so everyone to speak there, right? So yeah, so that's the purpose of the meeting, and I think we started it on 1st November, October itself. Yeah,
Okay, okay. So I'm not very late.
yeah, no, no, we can discuss. We are free, and you can discuss anything over here like you want. So yeah, Ayushi, please go ahead.
Aishman, Aishman, can we discuss a question that why to choose you among 200 applicants? So can we discuss that question?
Yeah, yeah, go ahead. We can discuss about that. Yeah, so we can just go talk about that question as well. So yeah, Hina, like you want to say something? You raise your hands.
Yeah, I did. I wanted to ask that do you have any recordings of your previous sessions or not?
No, I'm recording today's session and that too after 9:30, right? So I
Yes,
think I
please
hope
do that.
yeah, I'll just try my best. I'm learning. Like I'm not very tech free, but yeah, I'm just learning. So I am recording the session. It's going on. Like I have recorded
Okay.
for 30 minutes so far. From tomorrow onwards, I'll record all the sessions if
Okay,
it works.
inshallah. Thank you.
Yeah, yeah. So we can just talk about that, Siddharth. Like first, you want to talk about the weakness thing. We can just quickly go over that as well. Or
Actually, I don't have anything in my mind. So if anyone else can shoot up, I can learn.
yeah, anybody wants to add, or I'll just briefly talk about that, like what we talked in the previous sessions, because I jotted all those points. So the first thing that we talked, like for me, my weakness is, like I'm over generous, or I would say I'm a people pleaser. Like I'm a people pleaser. I try to please everyone, right? But I have to draw a line. I have to learn that it's going to affect my health and performance at the end of the day, and I can just say I'm working on that, right? And I should learn the art of saying no to people. So I can say I'm working on learning the art to say no to the people. I learn, watch different videos on YouTube regarding that, and I think I need to work on that. The other thing that we discussed, that like in my case, I'm over generous. Like I try to help as many people as out, but I have to understand that I cannot do that every time, right? I cannot just let that affect my performance. Then somebody told that absent mindedness can be, you can even talk about like I'm absent minded at times. So like then you can add this, I'm working on that as well. Somebody told that I procrastinate under stress when I'm given a bigger task. So I'm improving over that by breaking that task into the small parts. Yeah, that's what I have noted. Please somebody can add something extra, like Indu,
Yeah,
Indu
that
or yeah.
that day I was joining a Pakistani session, and there were some seniors. They were saying that whenever they ask you about weakness or strengths, you tell the weakness and strength, but also you elaborate it by giving an example. You just
Yeah.
don't say that I'm disciplined. You have to give an example. Like you can say that, okay, I'm a people pleaser. Okay, fine. So once that happened, and that's my defensive mechanism. So there was this senior on our APNA webinar, and that's how he explained it. He said that everybody knows that what is in the books related to good points and bad points of a personality, but you also have to add an example into it. So that's I like about it. Like there should be some specific examples. We should know about our three strengths, three weaknesses, and three examples related to them. So that's what I wanted to add.
Yeah, that's a good point. Yeah, yeah, we can add up examples for sure. Yeah. So two people raised their hands. I think Ayushi and someone else. Ayushi, please go ahead. Yeah, Ayushi, you want to go and you want to speak something? Or
So I can go if Aisha is not ready.
sure, sure, please go ahead. Or
Okay. Okay. So my weakness is that I noticed during medical school that I had a fear of public speaking, that I didn't like speaking in front of crowds. But I was able to identify this weakness quite early. And this led me to volunteer for numerous organizations and outreaches. So during outreaches, I knew that I needed to go out and speak to the people and educate them. And during this, involving myself in doing all these volunteer organization and outreaches, I was able to learn the art of public speaking, because one important skill a resident should have is communication, being able to enlighten his community and teach them about their health. So the more I did these outreaches, the more I got better with public speaking. I'm still working towards it, but that's just the weakness I've had.
that is even a very good point, like you said, Dr. Reese. So yeah, even I can say that I have a problem with public speaking as well, but I try to overcome it by I used to conduct webinars through my Instagram page. Plus during the interview preparation time, I used to make connections and talk to people, and we conducted webinars with more than 50 people every day, and that's how I was able to overcome my fear of speaking publicly. You can even say that, right? Anybody who speaks here or anybody who is present here can say that, like, we used to conduct the webinar and we used to speak in front of more than 50 people, and that's how we used to overcome it. Yeah, that's a good point.
Yes. 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 Thank you.
Yeah, Ayushi, you raised your hands, like you could
Yeah.
speak.
Yeah, I was just asking the question that why to choose you in 200 applicants. I was not clear with that question. So if there is someone who has the better answer.
So Ayushi, I posted that on my Instagram page. Like, so I got relatively good responses. You can just check them out as well.
Okay. Okay.
You can just check, like, I like the answer, so I can use those points in my question. But yeah, definitely we'll discuss that question tomorrow. That's a very important question, that why you amongst 200 applicants, or
Yeah.
why you are so, like, why should I take you into your program, like, or even different aspects of that question. So answer will remain the same, but we can discuss it tomorrow, right? If somebody wants to talk about the weakness right now. Yeah, Indu, please go ahead.
They can ask us what are your three weaknesses. Like they can ask us three, right? If we don't remember three, one or two. Really, it's difficult to like put three weaknesses together.
Into That's not hard. I think you just have to work on that, right? You just have to find out the weakness. Like, yeah,
Mm.
we mentioned, like, you can even talk about the public speaking fair, and you know something like that. You can just work on that. You just
All
have to
right.
find out, like, you can get ideas from that, and you can just club that with the example, and you can present it that way.
Makes sense. All right.
Can we add in the weakness
Yeah.
that since I belong to a businessman family and there is no one who is a doctor in my family, and I didn't have any guidance so far. So can I add that as a weakness, that since I was not having any guidance or any doctor related family, so
Certainly
I
not. It's
had
not a
to work very
weakness, but it's
hard
just
in
a
that sense.
condition. That's
But I
you will
think
not
that
be
is your
alone.
strength.
Yeah,
Like,
that's your strength. You came so
Yeah.
far. That
You
yeah,
can
webinar.
you
mention
came all across from
somewhere.
a businessman family to being a doctor. I think that's a strength, not a
Yeah.
weakness.
Yeah, but every time I have to struggle so much, and that's the weakness. that
And I
decreases my
think,
Yeah,
guys,
confidence
that
level
the public
in the
speaking.
field.
you have to
Yeah.
struggle, and you did struggle, right? So that is your strength.
Yeah.
Yeah,
Okay.
struggle is part of
Okay.
evolving. Yeah, we struggle and evolve and become more confident.
Okay. Okay.
And I think public speaking would be very overused. So be careful because the public speaking. Can you hear me, guys? I don't know.
Yeah, we
I
can.
think no, great because the public speaking is the great weakness because it's not a problem for programs that they will find. Oh, okay, and they have like improved it. So I think that every other guy would speak it about that, but if you use it in the like list of three, not just the first one, you comes up to your mind, just make it very personal. For example, I was thinking to use that example in the way that when entering into the med school and um, uh, declaring during the medical conferences, I found out that I was thinking about the every judge, thoughts of their mind. How would they evaluate me? So what I did, I went out of my comfort zone and started to join the like my medical school drama classes, where I had to perform on the stage, not just what I was thinking about, but also the emotions and to transcend it. And after it, public speaking came like really easy for me. So I think if you rephrase like that, maybe it can be more specific. I don't know. Even now, I'm thinking, besides my experience in drama classes, I'm still thinking, is it a good example? Because I think it will be very overused to say that as a weakness. I think like every other guy would say so. What do you think, guys?
I think great your answer, like,
I think we
with
can
the
also,
examples.
yeah, I think we can also add research as a weakness because, in my opinion, that I always wanted to do the research, but then in our country, the colleges don't appreciate that much, and I couldn't have that much chance to do much research in my country, and that was my weakness. But now I would like to carry on this, and I would like to get more exposure and learn more for the research, so that although I'm very curious to know all these things, but then it was kind of my weakness. I couldn't do that. Can we add that?
I I think
No, no,
I
no,
think
guys.
you
I
should
want to
not
say
bitch
something
about
to
your
Ayushi.
country. Like,
Ayushi,
Please,
it's
Siddharth,
not
what
like
sentence
India
did
does not
that?
has
can you just
research.
let him speak? Then we can just finish. Like you can just speak after the Siddharth.
Yeah, okay, so that carry on.
Yeah, so I think we should not bitch about our country. It's not like India does not have research. It's the thing that it's not incorporated in our curriculum. We can obviously
No,
go
I was
and
just
But
yeah, I was just telling about my
Ayushi,
college
one
that
sec
I
before
couldn't
you
get
go
that much
further.
chance.
Ayushi, before you go further, I was listening carefully with the wordings you use. Like, my country doesn't appreciate
yeah.
much. No, we won't use such words. Appreciate. The only difference is our country doesn't have enough infrastructure, enough resources. That's why we didn't get opportunity to do that. Like that, you can frame.
So yeah, so before continuing,
They
like
don't
Keshav something
focus
typed.
on research.
Yeah, Ayushi, please go ahead.
Yeah, I was saying that we don't need to use these words. I totally agree to your opinion, but then I was saying that there are no much chances of the, while we are doing MBBS, there are no much chances in India. Definitely, we'll not use these words, but I couldn't get much chance. Although I was very curious to do much research, but then I was not having that much resources or in my college as per.
To use that as a weakness, you can reframe it. Lack of experience is a weakness, but not just directly research. And it is in the end of the list of weaknesses.
And not
So
having
you
the
can
research.
definitely use it like a lack of experience,
As Gia
but you
said in
can use
the
it in community systems, not the like university or I don't know. Like it's up to you.
and as
But
Gia
actually, you
mentioned in
can.
the chat box that having not having research is not a weakness actually. To be honest, right? You can always have new opportunities in the future, like that. You can say that, even that you can say while speaking about like why you want to come to US, because it has more research opportunities. Like if the setting offers the research thing, then you can mention about that, but it won't be your weakness. That's what that's what like it's something very personal, right? Like how you feel and how you're working on that.
I would like to clarify something. When they ask about weakness, are they not asking about a trait? Like,
Yeah, exactly.
It
That's
should be a personality trait or about you as a person, not where you lack as an experience in your CV. That's a different question. They
yeah.
do ask this as well. Where do you think your CV is lacking or something? That's where you put your lack of experience in research. But here it's particularly about you as a person. The weakness part is you as a person. How will the residency program be able to accumulate you with your weaknesses? That's what they're trying to know, not anything lacking in your CV. Experience in your research goes into your CV. That's
yeah,
what I personally feel.
yeah. Ayushi, you can always have an opportunity to learn about the research in the future, right? That is not a weakness. Like not having doing the research won't hamper you treating the patients, right? Or you can just improve on
Yes,
that by
Aishan.
yeah. So like that's what we feel. Yeah. So there's Kesha Desai. He mentioned something in the chat box. Just go through that, and somebody wants to answer. Like about his, he mentioned about a weakness that he feels intimidated when working with the individuals who hold a higher position or have more authority. Like in such situations, I become more hesitant to express my ideas or concerns. And then he has mentioned that how he overcomes that weakness in the comment below, that I try to overcome them by actively putting myself in situations that requires interacting with the individual in a higher position. That this practice helped me gradually become more comfortable in such scenarios. I welcomed feedback from colleagues and supervisors. So Kesha, that's a very good weakness. But yeah, instead of talking about people in the higher position, you just tell them when people in authority, while dealing with them, I feel a little bit intimidated. But yeah, I consider that as my weakness, and I'm trying to work on that by interacting more and more people, and and I feel that has helped me come along. That has helped me to become more comfortable to be in that scenarios, and I'm working on that as well. Like that's a good weakness you can talk about, and how you're able to overcome that. Like in my opinion, somebody wants to add something, or we should move to Siddharth. Siddharth, just go ahead. Do you raise your hand? Like we just have 5 minutes left. Yeah.
Yeah, during my rotations, I got to know that I learned that most of the patient, English is not their first language, while
Yeah.
Spanish is. Okay. And when dealing with that patient, I need to use the interpreter. And I believe that if I can communicate with my patient in their language, that would make the patient more comfortable and more safe. But I lack the command over the Spanish language. That is my weakness. And estoy aprendiendo español. I am trying to learn Spanish so that I can make my patient more friendly and more comfortable with me.
Somebody wants to add something to that, like talking about Spanish. Unless or until like I feel if you're
Again, the same thing
yeah.
that he has said that he doesn't know Spanish. But my question is like, this is not your trait, right? This is not your personality trait. This is something you don't know, but you will learn in future. So, can we mention these kind of things like that? Like, we don't know this language, so this is my weakness. Just saying, like,
You can just,
maybe
I
it's
don't
not
think
a
it's a
trait.
weakness. No, it's not a weakness.
Yeah.
It's not a
Mm-hmm.
person. You can just mention if somebody asks you, like, what are your plans in the future? You can mention,
Yeah.
you can mention that I learn to, I'm planning, I'm learning about Spanish so that I can have a fluency in that language, and that will help me to,
Mm-hmm.
improve. That will help my ability to treat my patients well, right? Since
Yeah.
Spanish is spoken by a large population in America, and in coming times, like
Right.
everybody knows that it's going to be the first language of America, not English, but Spanish is
And
going. going to
Yeah,
see
the
all.
one thing which I wanted to ask is like, can I mention that I am just saying that I am soft hearted, and sometimes it's not your good side, it's also the evil side that people can ask you to do anything because you're soft hearted. So this is also a weakness too. So what you guys think about this one? That can you say that I'm soft hearted? Like I'm just trying to sail out me like that. That I wanted to say a quality in a covered of weakness. You're getting me right?
Yeah.
So can we say that? I just
But
want to know
how you are
if you
overcoming
guys.
that? That's a question, right?
So I will say
Oh,
that
just a second,
because
Hina.
I'm soft hearted.
Just a second. Sorry to interrupt you. So the class will end in 2 minutes, I think, right? So like it'll end abruptly. So yeah, we can just continue with the session tomorrow, right? So we can have the same session on the Google Meet for 1.5 hours. So yeah, Hina, just go ahead, please. Sorry to interrupt you. Yeah.
Yeah, so I will say that because I have been a soft-hearted person since I was a child, but now I try to rationalize things. When somebody is trying to ask me to do something or do a favor, then I try to rationalize and I try to see the pros and cons. So that's what my defensive mechanism are about it, that I'm trying to weigh the things out like that. So maybe then I can say something about that. What do you think about it? Like, can we say it like this is our weakness, like being soft-hearted is a weakness?
You can say that as I'm becoming more mature, so I'm learning how to deal with that. Yeah, as Gia mentioned, chat, you can just mention an example. Yeah, Prakash, please go ahead.
Hello, thank you, Aisman. So, I would just like to add, the point program that actually tell me about your weakness. So it's not that we should tell, yeah, I'm weak on this and I'm still weak. I mean, so he should know that he's still weak in these things. Rather, I would take it like, okay, I was weak in these things. This is how, this is what happened because of this weakness. I realized this and how I improved this and what I am now. So I think this is the thing. I mean, you have that weakness, but throughout the time you overcome that, and then finally this is what you. I think that would be better rather than telling
Yeah,
I'm
that
still
makes
weak in
sense.
this.
Yeah.
So, for example, if I take an example, suppose so someone's talking about their communication skills, right? So he would say like, okay, I was like I have difficulty talking with people, or I have not this good ability to talk. So they would say like I fear that it would impact my career, right? And this pushed me to work on this, and I started collaborating with people, teamwork, and this experience helped me to build my confidence and dealing with people this way. I was able to confidently relay my thoughts. So this is a kind of connection where we start a weakness, and then we'll tell how we improve that, and then who am I now. So I think this could be a good way to put our weakness. Thank you.
Yes,
Yeah.
you're right. You phrased it quite well. Thanks.
Yeah. Yeah. So somebody else has to add. The meeting hasn't ended yet. Somebody knows how much time is left for something which shows on the screen, or I think like it's should we end the meeting now? Like we can just talk about tomorrow. Like we can like why we should take you, or why you amongst 200 applicants. We can talk about it, and we can just club it with one more question, because I think like so far we have covered a lot of questions, and then we can soon